We're now joined by Dr. Kerry LeBenger, who is Chief Medical Officer of Summit CityMD. Good to see you, Doctor.
Thanks, and thanks for having us and letting us tell our story and the story of the boots on the ground in healthcare during COVID.
Well, describe what that looks like, because you have said to our producers and said to others, we need to follow the science and don't follow the fear. Break that down.
Yeah, so the science tells us who are the high-risk patients, who aren't, the incidence of the COVID-19, what the treatments can be, what the treatments can't be, and over the last 6 months from a disease that was not known, although coronavirus, as you know, it
Right.
causes the common cold, to our knowledge now, every day is a change. We now know who are high-risk people, how to treat better in the hospital. But even with all that, the science told us from 500 years ago that everything that Dr. Fauci and our leaders have been telling us still holds true. Masks, washing hands, and socially distancing are the best way not to get an infectious disease.
By the way, by way of background, Dr. LeBenger completed his fellowship at New York Hospital Cornell Medical Center, which is in fact where Dr. Fauci also studied, correct?
Correct. Tony has been well known to all of us. I'm older, almost as old as Tony is. We were at Rockefeller University. Tony was a leader in what we call vasculitis in the 70s. Then with the AIDS epidemic became one of the world leaders. And then every few years pop up with whether it be SARS, MERS, H1N1. So we all have a great relationship, although from afar, and his leadership has told us to follow the science.
By the way, let me make it clear to folks that Summit CityMD is in fact an underwriter of our healthcare programming. Doctor, I want to follow up on something. The vaccine issue. How much should our focus, from your perspective, be on the vaccine? I know there are multiple clinical trials right now. And how much should be on therapeutics, but also on protecting ourselves and protecting others?
Well, I think we all know, and Steve, you're probably a big proponent, the best disease or the easiest disease to treat is the one you never get. So by protecting yourself is the first layer. And until there's an effective vaccine, and let me say, there's going to be an effective vaccine.
You're confident?
I'm confident. I'm a clinical immunologist. There are so many good people and brilliant people working on it. And the technology is so much different than it was 20, 30, 40 years ago. And the science between some of them are messenger RNA, some of them are gene therapies, some of them. So there's so much different going on now that there will be a vaccine. And here's the thing, it doesn't have to be perfect. It just has to be safe and get us to that herd immunity to stop the spread going forward.
For those who continue to push, open up the country. Why aren't we playing more sports? Why can't kids go to school? You say.
I say, be patient, okay? I think at this time, with the fact that we know that a vaccine is only maybe 4 to 6 months before we get it out to the public, to those vulnerable people. So this is going to be a lost year. Just chalk it up as a lost year, and let's continue to do what we're doing. Don't open up quickly. And by next spring, after the vaccine's been out for a couple of weeks, we immunize the high risk, the moderate risk patients. Then we could open up and enjoy our lives, and it'll be a thing of the past.
It's interesting, Doc. You're calling it a lost year, but it's also a learning year, because you've said publicly what an incredible sea change in the world of healthcare post-COVID, or during and then post-COVID. Describe what that change looks like.
Well, absolutely. So one, taking good care of yourself. And if you look at the risk factors, and it's very interesting, Cleveland Clinic just came out with a risk assessment tool to see who's at risk of getting hospitalized, and it's been validated. You know, if you have the risk factors, diabetes, hypertension, all things that can be treated with easy preventative medicine going forward. Good social hygiene. Also, these things could have all been prevented. And now we're learning so much more about the immune system. You know, in the 1600s, why did half of Europe die of the bubonic plague, or 1500s, as opposed, and the other half live? What is about our immune system? And we're learning so much from this disease. Now, it's sad that, you know, so many hundreds of thousands of people have had to give their lives. And
That's right.
it's kind of disrespectful when we see people socially being irresponsible. It's
Or
disrespectful to
not
the health,
wearing masks,
not
refusing to
wearing
wear a
masks.
mask, like it's a political statement.
Right. So I tell to those people, you know what? It's a political statement, but you know what? Make your political statement in 6 months. Right now, why don't you just respect the people, like your loved ones, the people, you know, you have you have a responsibility. You know, you are your brother's keeper. And it's amazing that some of these people who want to make the political statement are the first ones to say, yes, we are a brother's keeper. But if you are, wear the mask, wash your hands, socially distance, and the vaccine will be out in a few months, and we could pick it up and go forward. What I think we're going to learn is that preventative medicine is everything, and Dr. Fauci for years has been wanting a universal flu vaccine, a universal corona vaccine, and maybe we could be more proactive than reactive.
Hmm. Dr. Kerry LeBenger, we're just a little bit, or even more than a little bit smarter after that interview, that conversation. So I want to thank you for joining us. And on behalf of everyone in public television, thank you and all of your colleagues on the front lines, doctors, nurses, respiratory therapists, a whole range of other people who are taking care of all of us and those who get sick with this virus. Thank you, Dr. LeBenger. We appreciate it.
Thank you very much for having me. Bye-bye.
You got it. I'm Steve Adubato. Thank you for joining us. We'll see you next time.